Hi, my name is Monse.
Hi, my name is Clemente.
Hi, I'm Hazel.
And my name is Eva, and today we will be talking about worker stress and veterinarians and different ways to reduce worker stress.
Yay!
Salutation, ladies and gentlemen. I am here to discuss about the individual coping strategies that you can improve on so we can make a better workplace. So the three main fundamental ways you can improve your individual coping abilities are just learning these habits, which is one, exercise, the second one being meditation, and the third one, literally taking deep breaths. Exercise is a powerful method of removing stress and has been deemed to be very effective. But is it really, is the question. In the recent study, we have discovered that Judith Isa van der Zwaan, it's a really complicated name, but she did research conducting about all these methods and dealing with the main principles of what causes stress, which her main three principles were sleep quality, depression, and anxiety. And in the experiment, she measured how meditation, exercise, and taking deep breaths can fix these dilemmas. From the experiment, Judith has concluded that exercise is 3 times effective in removing anxiety. So it's 3 times more effective and lowering the values of high levels of anxiety. It's 2 times effective in removing depression. However, it's deemed to be ineffective in fixing sleeping quality. So that means exercising will not improve your sleeping quality. So don't do that. That's bad. In the second part of the experiment, she measured meditation and the whole aspect of sleeping quality, depression, and anxiety. So meditation was deemed to be slightly effective against anxiety, but not as effective against depression. Meditation was very good against depression, but was deemed not very effective in sleeping quality. As a matter of fact, it would do the opposite. It would make you slightly worse for some reason. However, in the Judith's final test, she measured that taking deep breaths and measuring the heart rate actually deemed to be very effective in all aspects. Probably not as drastically as exercise, but it would always lead to a positive curve, no matter what the stress was. Stress is shown to be a very deadly problem in organizational and personal lives. However, the solutions that we find to them are quite clear, and it's just about building healthy habits on how to deal with these levels of stress. That's it.
Hello, today I will be discussing organizational coping strategies, which are company rules and practices that minimize worker stress. And in order to minimize worker stress in veterinarians, it is important to address the institutional factors that contribute to stress. It is most effective to start stress management training as early as possible. By implementing this training into the curriculum of veterinary students, we allow the students time to adjust and implement these coping strategies into their life before entering the workforce. It is also important to remind these students of the resources available, such as counseling. There are also ways an employer can help veterinarians deal with stress. The first part is going to be training aimed to teach veterinarians different coping strategies and how to identify the signs of stress. In a study ran on Chinese nurses, it was found that hope and optimism were 2 traits that help mitigate the effects of stress. In order to increase these traits among workers, training is necessary. Hope training will be done by teaching employees to make goals that are specific and help them find clear paths to get there. Optimism training will be done via online cognitive behavioral therapy to allow for people to do it on their own time. It is also important for staff to interact together outside of work in fun activities. This helps create trust and a more comfortable environment to discuss and debrief any events. Employers should be debriefing after impactful events to help staff process what is going on. There should also be a grief counselor or at the very least an anonymous helpline for staff. Lastly, employers should provide nap areas that allow breaks for workers during long shifts. This will help mitigate the effects of stress and burnout. It is also important to evaluate and update these trainings and practices every few years in order to stay up to date with the best and most effective methods.
Greetings, Earthlings. I'm here to talk to you about veterinarians. Since approximately 6 in 10 people in America have a pet, chances are you know of veterinarians or you've even met one. But did you know that veterinarians are actually at an increased risk for suicide? Especially when compared to the general public. In fact, researchers in one study surveyed 10,000 employed vets and found that 14.4% of male respondents and 18.1% of female respondents experienced suicidal ideation. In comparison, 5.1% of males and 7.1% of females in the general public reported having suicidal ideation. That's approximately a 9 to 12% difference in suicidal ideation based solely on occupation. Furthermore, 6.8% of male and 10.9% of female veterinarians surveyed had serious psychological distress. So in other words, approximately 1 in 6 veterinarians experience suicidal ideation and approximately 1 in 10 experience serious psychological distress. But why is this the case? Well, there are certain factors that contribute to suicide rates among vets, such as self-selection, negative effects in undergraduate training, work-related stressors, and psychological morbidity, which you can see in the figure on the screen. But today we're going to focus on worker stress. Worker stress is defined by this lovely book as the physiological reactions to events that are perceived to be threatening or taxing. In particular, we're going to be talking about ways to decrease worker stress, such as improving individual coping strategies, implementing job rotation, and applying organizational coping strategies.
Job rotation in the veterinary field is crucial because rotating in different units decreases the risk of depression, suicidality, and helps them cope with the sad situations that happen with animals within the different units. Rotation and how it decreases worker stress. Job rotation is transferring employees from one unit to another as to increase their credentials in all aspects. Job rotation within the same workplace inspires to achieve higher performance, allowing continuous growth and development of new knowledge and skills. Scholars propose that job rotation may help employees to acquire multiple skills and expand their vision, thus reducing the risk of job burnout. Job rotation means neither job promotion nor paid adjustment. It avoids organizational politics, which is great because there's no competition to be better than anyone else. For example, in the veterinary field, there's not just one person euthanizing all animals, which is really sad. In an article I read, there was a study on job rotation with nurses in hospitals. The study had a 100% participation rate, and the nurses' mean age was 31 years old. Most of them were women. The study aimed to analyze the influence of job rotation between different units of a surgery service. Significant differences were found in the organizational aspects of rotation and nurse satisfaction. After the study, the nurses were found to be more satisfied with their jobs and seemed happier. They were put in different positions like the ICU, IMCU, and the ward consultation office. The lack of rotation was more frequent in the group of nurses who were neither satisfied nor dissatisfied, which can be negative in the long run and leads to turnover because they don't have a sense of actualization. The point